Okay guys, this is skill 18.4, wet to dry dressings, or what some people might refer to as saline moist, okay? So how are you going to start this off? You're going to check your physician's order and you're going to perform WIPSA. Now if this had a wound dressing on it, you would remove it the same way, you know, remove all the tape, move it away, remove it towards the client, okay? So that the bottom part, the part that's towards the patient, is going to be towards us. We don't want them to be exposed to that, okay? So you're going to do that, okay? And then you are going to remove any wound packing. So this wound right here, as you can see, is pretty nasty, right? It's pretty nasty looking. Has a ridge of necrotic-like tissue, okay, that we really would like to revascularize, okay? So wet to dry dressings are used only to debride wounds, okay? They do this by causing tissue damage, okay? So as the wet dressing is on the wound, as it dries out, it sticks to the edges of the wound, okay? And then when we take the dressing off, obviously we take off edges of the wound, which makes it bleed. And bleeding is good because we want it to heal quicker, okay? How often are you going to do this? Well, unless there's excessive drainage happening from the wound, meaning the wet to dry dressing is in place and wound seepage is happening, you know, blood or exudate from the wound is coming out of the dressing, or if the dressing dries out too quickly, then we're going to do it sooner. But normally you're going to do this dressing change about every 8 hours, okay? So a wet to dry dressing is about every 8 hours, okay? All right, so how do we do a wet to dry dressing? Well, it's a sterile procedure, okay, because we want to keep this as clean as possible, right? So we want to do it as in a sterile procedure. So again, according to your facility policy, determines whether you're going to have a mask on, okay? Probably gonna, okay? Probably gonna have a mask on to do this. You may actually also have a bouffant on your hair, okay? Again, according to your policy of your facility, anybody in the room may have to have that on, okay? So if you have somebody that's helping you, they may also have to have a mask and a bouffant on, as well as the patient, okay? So you're going to have to know your policies for your facility, okay? So you've done all this, you've removed all the soiled dressing, and so then you would remove your dirty gloves because you've been touching all of this, right? Okay. The next thing you want to do is you want to get your equipment ready, okay? So open up all of your equipment. What is your equipment that you need? Well, first of all, you're going to need normal saline, okay? So you're going to need that, whether it's in a bottle, whether it's in saline flushes, because those can be used, right? Because we could squirt this, we could squirt it onto our gauze that we're going to use. We're going to need an ABD pad, okay? An ABD pad. We're going to need tape, okay? We're going to need a bag to put all of our dressing supplies in. And we're going to need gauze, okay? Now, a nifty little way of wetting the gauze is to, remember, this is sterile in here, right? Okay, you can open it up like this. See how I got a slight little opening? Open up your normal saline, okay, and pour it into the container. Okay, saturate those dressings, okay? So now all of our gauze inside of this package is still sterile and it's all wet, okay? Because remember, we're doing a wet to dry dressing, okay? So you're going to put those to the side. Now you're going to be putting on your your sterile gloves after you have put on, got all of your equipment ready, right? Okay, so you're gonna put on your sterile gloves the way that you would normally do it. Okay, I'm not doing it on the video because you should know how to do sterile gloves, right? Okay, I don't have to show you how to put sterile gloves on. Not at this point. You should know that. And if you don't know that, then you better be in here into the skill lab and you better be practicing. Or you better get a pair of sterile gloves and take them home and practice and practice and practice, because it's really, really important that you know how to put sterile gloves on, okay? So I have my sterile gloves on, okay? So now what I'm going to do is I'm going to pick up the sterile dressing gauze dressing one at a time. Now, some facilities it may be in packages like this. Other facilities it may be in those plastic container tub things that you would have opened up and just poured the saline in, okay? So you're going to take the gauze, okay? We're going to pretend that it's in a plastic container at this point, okay? All right? You're going to take the gauze one at a time, and you're going to fluff it out. When I say fluff it out, you don't want it all bunched up in one, okay? You're going to open it up, get it so it's nice and fluffy, all right? And then you're going to pack it into the wound like this, okay? Pack it right in there. Is this going to hurt your patient? Yeah, it probably is. So what's a good thing to do before you do a wet to dry dressing? That's right, you're going to give them pain medicine, okay? Because this is going to hurt. Especially when we pulled that dressing off and pulled off part of the necrotic tissue and made it bleed. Anytime you bleed, don't you hurt? Yeah, exactly. So, be preemptive about this, okay? Give them some pain med prior to doing this dressing change, okay? All right, so now we're packing this wound. We have one more piece of gauze here. We want to fluff it up. We want to put it in our wound like this. Yes? Oh yeah, look at that. Now, how are we going to keep that in place, you might be saying, right? Okay, so that's where that ABD comes in handy, right? ABD is that big pad. Remember, it looks just like this. Blue side usually is up, okay? This is the side that goes towards the patient. If you remember, blue up, right? So blue up, B up, blue, okay? So this is too big, right? So what can we do? We can fold it up, okay? And make it so that it's not so bulky, but we want to cover the whole wound, right? So we want to cover the whole wound. All right, we got that. All right, and it may need, more than one ABD on here, because if it starts to seep through, it could be a way that it dries out quicker. So we may need to have more than one ABD here. And then you just take and tape all of the sides, all four sides of the wound to keep that moisture in there. Okay? So then you're going to position the client in comfort. You're going to put the bed to the lowest position. You're going to discard all your stuff. You're going to take off your gloves. You're going to perform hand hygiene. And then you're going to assess this wound, right? Because we're nurses, we assess all the time. You're going to assess this wound. You're going to assess the dressing to make sure that it's not, seeping out of, okay? You're going to make sure that it still looks kind of wet, okay? You're going to redo this it's sooner than 8 hours if it dries out, right? Because we want it to be wet to dry, okay? You're going to provide the client and the family any teaching regarding it, and then you're going to document the care in the patient's chart. Okay, so that is wet to dry dressing, saline moist, skill 18.4.